Good day to everyone, and welcome back to the Coffee Break program once again. And today we are going to discuss about the long COVID syndrome. As you may have already heard, there are more than 2 million patients in the United Kingdom who are suffering from long COVID syndrome. COVID-19 is persistently troubling the human beings, and slowly, humans are getting used to live with COVID and adapted so much of methods to overcome the effect of this COVID-19 virus. Among them, the leading hero or the leading process is the vaccination, and vaccination is going on all over the globe, and the cases are slowly getting reduced due to proper vaccination and usage of proper sanitary care with preventive methods. And now a new issue has come in front of us, that is the long COVID syndrome. The COVID-19 patients who suffered from COVID-19, and some of them do get cured completely, and out of the patients, about 20 to 35% of cases are going to be long COVID haulers. That means some of the symptoms in some or other way lasting longer than what is expected, and by that their day-to-day functional ability and their health is affected so much. So they are called long haulers, and I decided to discuss about the long COVID syndrome today in details. We have a lot of syndromes in our medical subject. The latest one which is going to be added is long COVID syndrome. As you know, COVID-19 is a global issue, and now we find a lot of people getting long-standing symptoms, and they are called long haulers. And we are going to discuss about the long COVID syndrome today, as I mentioned earlier. And according to the NICE guidelines, there are 3 stages of recovery from COVID. First stage is called acute COVID recovery, when a person got infected with COVID-19 and his symptoms completely recovers within 4 weeks of time, and that is called acute COVID recovery. There are some patients whose symptoms persist longer than that. And if those symptoms are persisting longer than 4 weeks to 12 weeks, this category is known as long COVID recovery patients. So they are also long haulers. And the third category is the one we are going to discuss about today, that is post-COVID syndrome, in which the symptoms persisting more than 12 weeks of the initial infection. So this is the category according to the NICE guidelines, and we are going to discuss about it in detail. Now we are going to discuss about the definition of this post-COVID syndrome. Actually, there is no hard and fast rule to define it at the moment, and this is a new thing, and everybody is doing their own research. And up to now what we can say is, once a patient is infected with COVID-19, if the symptoms are persisting more than 12 weeks after the infection, and these symptoms cannot be explained by the light of any other medical condition, then it is called post-COVID syndrome. Let's analyze the COVID-19 post-COVID syndrome symptoms. The most common and the leading symptom is fatigue. People become fatigued, and if the fatigueness persists more than 12 weeks after being infected with COVID-19, so this is the leading symptom of post-COVID syndrome. And respiratory symptoms, the next common group of symptoms. It's a group of symptoms. One can present with shortness of breathness, which is persisting, or chest tightness, chest pain, and cough. So these are the respiratory symptoms with post-COVID syndrome. And brain fog, this is a layman's word, but the word gives us a lot of information. Some people who get COVID-19 infection and post-COVID syndrome, they are persistently becoming cognitively impaired, and they are persistently getting memory problems. This is not dementia, but this is some sort of a delirium-like picture, and a lack of concentration. They say that they are not able to concentrate as before, and these things are called the brain fog. It's a complicated group of symptoms, and when we discuss the etiology, I will try to explain as much as the reason for these persisting symptoms. The previously discussed 3 symptoms are the most common symptoms of post-COVID syndrome, and there are about 30 symptoms that we can explain and identified as post-COVID syndrome. But these are the brief explanation, brief categorization of those symptoms. First, headache. Persistently, you can get headache as a symptom of post-COVID-19 post-COVID syndrome. Alteration of sense of taste and smell. So this is also one of the symptoms which can persist in post-COVID syndrome. This is grossly due to the involvement of the olfactory nerve through the direct infection of the COVID-19 virus, and this can persist as a post-COVID syndrome. Myalgia, the body aches. Many patients complain of body aches. And poor appetite. Poor appetite is also recognized as one of the post-COVID symptoms. Gastrointestinal symptoms. This is a group of symptoms that presents as post-COVID syndrome. For an example, some people may experience excessive flatulence, and some people may experience altered bowel habits like diarrhea, constipation, and persistent diarrhea, and abdominal cramps and abdominal pain. Autonomic symptoms. There are so much of autonomic symptoms, as you know, and out of them, the paroxysmal orthostatic tachycardia syndrome. That means when you stand from sitting position, the autonomic nerve system should adjust the blood pressure accordingly, and the heart rate and blood pressure get stabilized. But in post-COVID syndrome, this stabilization is defected, so they go into tachycardia when they stand from sitting position to standing position, which is called paroxysmal orthostatic. Orthostatic means according to the positional change, tachycardia syndrome. Hair loss. A lot of people with post-COVID syndrome complain of hair loss. Or altered sleep pattern. This could be hypersomnia or insomnia. Some people can't sleep properly. Some people have daytime somnolence. They are very, very sleepy during the daytime. And some people can't sleep at night. Altered sleep pattern, right? That is it. And numbness, dizziness, and tinnitus. These are all neurological symptoms, and I put it as one symptom, but it comes under various categories. So tinnitus is different, and dizziness is different, and numbness is different, but they are neurological symptoms of post-COVID syndrome. And rarely we found patients with post-COVID psychosis and this could be the only presentation of this post-COVID syndrome symptom. So we have seen patients with post-COVID psychosis as the only persisting symptom, and some of them do get hallucinations as well, but those are rare symptoms. Let's discuss about the vulnerable category of post-COVID syndrome. And one can think that if somebody gets severe COVID, obviously that patient could be a vulnerable candidate or vulnerable person for long post-COVID syndrome. No, it is not the case. If somebody gets even mild symptoms, that person can be a vulnerable person for long COVID or post-COVID syndrome. That means the severity of initial infection is not proportionate to the longevity of the symptoms, and post-COVID syndrome is not related to the initial severity of the infection. Somebody who got severe infection initially could have been cured by 4 weeks time, and somebody who got very mild symptoms or asymptomatic even can go up to long COVID syndrome and post-COVID syndrome after that. So the initial severity of the infection is not relevant here. There are some vulnerable categories who can get post-COVID syndrome, especially young ladies. Their immune system are quite different from gents, and they are more common to get autoimmune diseases, as you know, and their immune system is a bit strange from males, and likewise in the post-COVID syndrome the young ladies are more vulnerable, and also old age above 70 years are mostly vulnerable to get post-COVID syndrome, and patients with asthma and other comorbidities, they are also vulnerable, they are also coming under vulnerable category. And chronic fatigue syndrome, they are also recognized as vulnerable category for this post-COVID syndrome. MCAS, mast cell activation syndrome, there are patients who get mast cell activation syndrome, and those patients are also more vulnerable to get post-COVID syndrome. Actually, this is one of the theories behind the etiology of post-COVID syndrome as well. So we will discuss about it when we discuss the etiology. We are going to discuss about the etiology now. There is no established theory yet, but there are proposed theories, and out of which the one is very credible, very much credible, but we will consider all the proposed theories. First thing, chronic infection. There are situations where they found that the SARS-CoV-19 virus can persistently be in the body as persistent chronic infection, and according to the BMJ, once they have found of a patient's particles of the gut consistent with chronic infection of COVID-19 virus for more than 4 months. So this is one of the theories, chronic infection, but not proven. And chronic inflammatory process. You know, there are so much of viral infections, and after the viral infections, they have a lot of chronic inflammatory processes. For an example, chikungunya, the viral infection, which is somewhat similar to dengue, can cause lot of inflammatory processes. For an example, the arthritis which causes by chikungunya can persist more than 1 year. Likewise, people suggest that the COVID-19 also can cause chronic inflammatory processes of the viral dead viral particles and contribute for post-COVID syndrome, which is not proven yet. Autoimmune reactions. Some sort of autoimmune reactions can be contributed to this post-COVID syndrome, and especially we can see the female category of young age is more vulnerable, so they are more prone to get autoimmune conditions than males. So there is a bit of a credibility there. And another theory is, once we get immunocompromised with the infection of COVID-19, the other dormant infections like cytomegalovirus, Epstein-Barr virus, measles, chickenpox, and so on and so forth can be activated, and as a result, these symptoms can present. Not proven, but that is a suggested theory. MCAS, mast cell activation syndrome. This is the most credible theory, and people say that mast cell activation is the main cause for this long COVID syndrome. Mast cells are eosinophils, neutrophils, and basophils, and they have lot of packs of histamines and serotonin, serotonin, histamine, and leukotrienes in their cytoplasm. And when the mast cells are stimulated, they burst into surge of mast cell activation, and thereby causes a lot of inflammation, and even anaphylaxis and death can happen due to mast cell activation. So this chronic mast cell activation is one of the credible theories that can contribute for this post-COVID syndrome. And especially the neurological symptoms are explained by demyelination of central nervous system, likewise in the case of multiple sclerosis, and direct infection of the nerve system to the olfactory nerve, and it can cause some sort of demyelination, and that can contribute for the neurological symptoms, especially like numbness, dizziness, and all these presentations. So these are some of the theories, but none of them are proven yet. And this mast cell activation syndrome, I'm going to do a separate video regarding this subject, and we will explain how it can contribute to post-COVID syndrome in another lecture. Let's talk about the management of post-COVID syndrome. First, we have to establish the post-COVID syndrome by exclusion criteria. So we have to exclude all the other sinister causes which can cause these symptoms. For an example, if you are worried about chronic dermatological symptoms or rash, we have to exclude other dermatological conditions, and then only we have to think of post-COVID syndrome. And if we think of any other cardiac symptoms, cardiac problems, so we have to exclude cardiac causes for that which can cause these symptoms. If there are no proper cardiac causes to cause these symptoms, then we have to exclude that. And even the respiratory system and nerve system, we have to exclude. GI system, we have to exclude the other causes, and then only we have to make sure that it is due to post-COVID syndrome. And any post-COVID patient could be referred to post-COVID clinic. In most of the hospital trusts now, there are clinics established for post-COVID syndrome patients. So you have to refer the patient to post-COVID symptom clinic, post-COVID syndrome clinic. And as a gross overlook, they suggest low histamine diet and antihistamines, and these are helpful in long COVID syndrome. And also, due to this fatigueness and daytime somnolence and muscle aches and pains, your day should be organized according to the prioritization of works, and you have to do only the prioritized work because you can't perform as previously. So get rest in between and prioritize the works and start doing them accordingly. And there are so many medications, even antihistamines like famotidine and steroids and even ivermectin and some other medications are being tried, but none of them are established treatments at the moment. So please be updated and be vigilant about the new findings of long COVID syndrome, as it is going to be one of the major syndromes all over the world next couple of years until we get rid of this pandemic. Thank you so much.